Hi.
Hi there.
Hi.
I rounded someone up.
My name is Frank Garcini, and I'm a gynecologist in private practice in New Lenox, Illinois, which is about 40 minutes south of Chicago. I've known Tracy for about 2 years now. I consider her to be an expert in her field and a very caring practitioner in physical therapy. And I have agreed to do this video because she wants me to share my thoughts on this product with her audience. I've been in private practice in my area for about 16 years, closer to 18. I'm sorry, and recently I became interested in this product that is called ThermiVa, and ThermiVa is a radio frequency probe that can be used in the woman that is experiencing certain symptoms such as vaginal dryness, discomfort with intercourse, um, uh, cosmetic external effects of the vulvar area, and I in having many patients that have these issues, I decided to give it a try. And we've had ThermiVa in my office for about slightly less than a year now. I can tell you that my experience with ThermiVa has been very positive. I cannot tell you that every patient that I've had has experienced ThermiVa has had a benefit from it, but I can tell you that the vast majority of my patients have experienced some sort of improvement or relief from their symptoms using the ThermiVa treatment. Those patients that benefit the most are those patients that have vaginal dryness, mild to moderate stress urinary incontinence, as well as issues with painful intercourse or undesirable cosmetic effects on the external surface of the vulva. This is a radio frequency probe that causes mild to moderate heat in that area, and as an effect of that can cause improvements in all the above. The improvements are due to changes in collagen formation in the vulvar vaginal area, nerve regeneration in that area as well, and tightening of superficial tissues in those areas as well. The vast majority of my patients who have undergone this treatment report some improvement in some or all of these areas. I cannot tell you that every single patient has significant or vast improvements in the area, but 80 to 90% of the patients who undergo these treatments will actually notice some kind of improvement. I can tell you that the improvements are more significant in those women who are younger. So in the 30 to 40-year-old crowd, there is a vast improvement compared to the 50 to 60-year-old crowd. Not to say that the second group does not notice any improvement. And I can also tell you that those women who are willing to undergo vaginal estrogen treatment will have more significant and quicker results than those women who are either unwilling or unable to have those treatments due to medical problems. I cannot tell you that this is a panacea, that this is the solution to every problem, but I can tell you that if you are experiencing any of the above problems, that a trial of this treatment may be to your advantage. So what does this treatment involve? It involves a probe that is inserted both vaginally and externally. The total amount of treatment time is about 30 minutes. We tend to tailor these treatments to the specific needs of the patient. So if the needs of the patients require greater use in terms of vaginal dryness or vaginal sensation, we may have more of a internal treatment. If it's more for a cosmetic effect, then we may spend more time externally. In addition to that, the treatments are about 30 minutes in duration. The recommended frequency of the treatments is about once every month for 3 months. And then if the patient feels that they have had a success in terms of the treatment, then we recommend that we repeat this treatment once a year. And when I say a year, I mean anywhere between 8 and 12 months. And we recommend that this be done just one treatment every 8 to 12 months to maintain the desired effects that were achieved with the 3 initial treatments.
One of the things I was just going to point out is that Francisco is not he's not a paid rep. He's just actually been using it in his clinic. So it was nice to get a perspective not only from those speaking at the front and the reps, but actually to have someone that's using this in your office and your practice regularly. Correct. I actually learned a lot, and I realized the risks that aren't nearly as bad as I was concerned about. The problem I found is that they're only 2 years into doing this. Correct. So we don't know long-term effects yet. We don't know what's going to happen. They said they hope it's not like mesh where they find out later there was a problem. But from what they can see, that those that are clinically doing this, is that it seems like there's been no side effects that you've seen at all. Really.
Up to now, there have been no reported side effects from this treatment.
One of the questions that Heather is asking about, the first one was, let's see, the second one right now, spend so much time without benefit, pelvic PT and dilator. HEP was what made the difference.
What was the difference?
It said here, Heather, maybe you can answer a little bit more. You're saying they were just really frustrated to spend so much time without benefit, or so much money without benefit. Oh. So there was a patient who had a shortened pelvic floor, and there was actually a tight pelvic floor.
I see.
And they ended up getting the ThermiVa, and it turned out that they actually needed a different kind of treatment.
Understood.
And I think one of the answers to this is what they're saying is that there's a lot they don't know, and I'm trying to bring awareness from a pelvic physical therapy perspective. And they said, we just will admit, we still send people to pelvic PT. We still have a lot we don't know. But for the patients that are looking for something, this may be an option.
Yes. So the clear indications would be vaginal dryness, pain on intercourse, or undesirable external cosmetic appearance of the vagina. Something like a foreshortened vagina may not benefit from this type of treatment.
Right, and on that note, one thing that stood out that they were saying is that it doesn't mean you take out all the other treatments. So like you were saying, there's still vaginal estrogen that can be used. There's still pelvic physical therapy throughout. That was one of the questions we had earlier. So you can still do pelvic physical therapy. You can still do estrogen. This is just another thing, an adjunctive therapy that seems to be very helpful for many women.
And again, from my personal experience, the results of these type of treatments are always better if you have some sort of adjunct therapy with that.
Yeah. And another question, one of the questions was how much are the treatments? And it seems like they're ranging depending on who's doing it. But the recommended is about $1,000 per treatment, but some are doing as cheap as, it could be $500. But anywhere from $500 to $1,000 per treatment. They're recommending 3 at a time, so 3 for 3 months. So basically, over 3 months, you do 3 treatments, each at about that $500 to $1,000 for a cost.
So it's a 30-minute treatment once a month for 3 months, and then a follow-up treatment once a year or anywhere between 8 and 12 months for a single treatment to maintain the effects.
One of the other fascinating things is that they're actually now saying they've seen great cases or effects from what they weren't even expecting for patients with lichen sclerosis and some other kinds of vulvar disorders that they weren't even expecting to happen. So that was interesting just from that perspective.
Absolutely. And the research is not out there yet. This is a fairly new treatment. and again, this is just my personal impression. This is not something that I can base on medical literature. It appears to me that this potentially could be a treatment that could address a lot of these conditions in the future by having a regular treatment every once in a while.
It was there's a question about, so we talked about radio frequency, but what's the actual mechanism? It's supposed to do like a heating of the tissue?
Yes.
Or, yeah.
So we don't have all the answers, but it appears that the radio frequency delivery of the probe causes a local heating of the tissues as well. Well, we notice that there's a heating of the tissues. We don't know what else is going on, but the issue is that apparently, mostly from the heating of the tissue, there is a rearrangement of the collagen in those immediate areas, and this rearrangement of the collagen, and also some evidence to suggest that there is nerve growth and nerve redevelopment in those areas, can increase sensitivity and increase lubrication and general cosmetic appearance of the area as well.
Yeah, and I think Heather was asking again about shortened pelvic floor muscles, not necessarily the canal itself. And the honest truth is, from my understanding, is we really don't know what effects it's having on muscles.
No, actually, we can for sure say that this has no effect on the pelvic muscles, because the range of penetration of the treatments is 1 to 2 millimeters, and that would be mostly superficial skin, and as well as superficial tissues, and the muscle areas would not really receive any significant treatment to that effect.
So one of the questions Heather had is, so just wondering how they are screening painful intercourse could be due to many variable sources.
Absolutely. Painful intercourse can be due to a great many different, large spectrum of conditions. So it's important that you have an evaluation done by someone who is experienced and knowledgeable in terms of pelvic pain, in order to determine what would be the best treatment for you.
Yeah, I think what many of these people in the room were all different backgrounds: gynecology, urogynecology. There was a gynecological oncologist. So basically, they still have to use their own judgment. But this is just one tool in the toolbox in terms of being in their office. But I think everyone still it goes back to the same thing. You still have to do differentials. You still have to do screening. There's still a lot more that you need to do before you just think that everyone should get this, I'm assuming.
Yeah, absolutely. Yeah. I agree with everything that you've said so far.
Okay. So if there are no other questions, we will sign off, and I will add I took a lot of notes and information, and I'll add that as well. So hopefully you have all of your questions answered. And
I want you to know that Tracy is awesome and that I endorse anything that she says.
Thank you. I'll give you a hug. Thanks. All right. See you guys later.